will no doubt embolden our understanding of these matters. But it's in its African Regional Strategy for Mental Health in the year 2000, the World Health Organization emphasized that populations in Africa are beset by numerous mental and neurological disorders that are causing disability. Furthermore, there is apparent lack of reliable information systems in many countries across the continent. However, some primary observations and estimates can be made. In many of these countries, the most frequent presentation of psychosis is acute or subacute, acute transient psychosis, paranoid psychosis, and a lot more. These words are a little bit big for an average moderator like Chris Higenyi. In the studio today, I have Dr. Lanre Olusola. He's a psychologist. I hope I've gotten that Nigerian pronunciation right.
You got it perfectly, Chris. Thank you for having me this morning again.
You're most welcome.
Thank you.
How are you doing?
I'm very well, thank you for asking.
The preamble is a damning assessment of our condition. The fact that mental health challenges continue to beset us and that there is a lack of reliable information systems in most countries to deal with the challenges that come with this particular aspect. First, bring us up to speed with the range of services and initiatives, interventions to tackle this particular spectre.
Thank you very much, Chris. You know, mental health is a major issue. And it's not just about Africa, it's global.
It's global.
1 in 4 people across the world will suffer from one mental health issue or the other. 1 in 4. So if there's 4 of us here, 1 out of 4 of us will have a mental health issue. Now, the critical issue with Africa is that we're not taking it seriously. The second issue is we spiritualize it. And yes, and the third issue is we do not realize its impact on our productivity, our performance, and our profitability.
Great. Let's tackle those 3 issues one at a go.
Yes. So, government needs to begin to think about formulating the right policies. We need to do our research and even identify how many people are suffering, how many people are struggling, how many psychologists do we have, how many psychiatrists do we have, how many therapists do we have, how many coaches do we have. Because if you don't identify how many people have it, then you don't identify the people that would address the issues, then you are leaving it to chance. Because ultimately, the productivity of the nation, the performance of the nation, the profitability of the nation is hinged on people's mental health issues. So we're realizing that people are not productive, we're realizing that people are malfunctioning, we're realizing that people are behaving abnormally, and we're not addressing the real issues. We're dealing with the symptoms rather than the critical triggers. We don't know how many people. So our educational system, our university system is not churning out solutions. Solutions in the guise of psychologists, psychiatrists, therapists, and coaches. So what will begin to happen? The number of people that will be affected will increase. Let me give you a classic case, right? The WHO declared that by the year 2020, depression will be the world's 2nd deadliest killer and source of disability. And by the year 2030, depression will be the world's #1 killer. An emotion.
Depression.
Research has shown us that 85% of all success in life is dependent on how emotionally intelligent and resilient you are.
Somebody is,
85% of your success is dependent on how emotionally intelligent and resilient you are. So at the very heart of your success, at the very heart of your productivity, your performance, and your profitability is your emotional resilience or your emotional intelligence. Why is that so important? It is important because every decision you make is dependent on an emotion. And every emotion you have is dependent on your belief. And every belief you have is dependent on how you think. And every thought is dependent on your circumstances in your environment.
Great. Let me hold you in your tracks there and go to the aspect of apparent spiritualization of the issue. You find people completely tagging what happens to them to the spiritual world,
Yes.
or attempts by people they cannot name to be responsible for some of the things that are happening to them.
Yes.
And then that belief rolls into their work, it rolls into their relationships, it rolls into their businesses. At that point, how do you realign that person's thinking? Because in the African context, if somebody is firmly anchored on spiritual belief and that somebody can be somewhere else and dictate what happens to them, it is very difficult to disengage from that. How are you crafting messages? How are you talking to people in order to get them out of that jinx?
All right. You know, as a people, as an African people, we're very religious and very spiritual. And that shapes a lot of the things that we do, and it shapes our perception, it shapes our thinking.
That's right.
It is at the very core of our belief system. And so when you experience something that you cannot hold, the first thing that you think is, this must be spiritual. So when someone that you've known for a while that has behaved normally starts to behave abnormally. So let's talk about psychosis, right? So the person begins to hallucinate. He begins to have delusions. He begins to tell you that, Chris, can you see this third person here? There's somebody here. Tell him not to touch me. Then you begin to step back and think, oh, wow, this guy, they're pressing buttons from the village. Not knowing that the guy is hallucinating. The guy is suffering from delusions. And it's the result of a spike in his dopamine level.
Spike in dopamine.
In dopamine level. And dopamine levels are spiked by stress in the environment. There's certain things that are stressing the guy, and he has a sudden spike in his dopamine level. Dopamine is a neurotransmitter that boosts, chemicals and releases chemicals to your brain, and you begin to, think hyper. You begin to see things. If you have too much of that chemical, it's almost like when you smoke a drug or you drink too much alcohol, right? What happens is chemical imbalance in your brain. It releases dopamine and adrenaline and cortisol. So the chemical imbalance in your brain makes you begin to see things. You begin to think things. You begin to hallucinate. So it is chemical, not spiritual.
What is the relationship between what appears to be misperception and reality? Because there are many times that what you see or could describe as hallucinations have a very almost equal relation to what the reality is.
There's a thin line between, virtual and real, right? Real simply means what you can touch and what you can feel. Virtual really means you're living
what you can imagine
in your head, you're imagining what you are thinking. But we all live in those two dimensions. We all live in those two dimensions, so it is the point of focus and normalcy that is the issue. Because you imagine, you visualize, you dream. You are living in an altered state of reality, and you crisscross on a daily basis. But the important thing, Chris, is that when you go into that realm, you can come out and act normally and behave normally. The guy that is psychotic, the guy that is schizophrenic, he can't. He's not functioning normally like you. Why? Because he's got excess chemicals.
There must be a way to help them overcome the excess chemicals. And for those that are grappling with psychosis, there must be also the how of how to realign their thinking and then get them back. And this is what perhaps many governments and stakeholders are not realizing in terms of rollout of the interventions. Now, you as a psychologist, one thing I pick from your submission is that you have been at this for a long time, coaching, educating, and perhaps realigning people's thinking and mindsets. In your view, when you look at the clients perhaps you've dealt with, the stakeholders that you've worked with, what could be the magic bullet in taking us away from the many things that affect how we think? Our circumstances are pretty known. Many of us have grown up in hard circumstances. They press on many buttons of how we think and how we do things, even when we come out of it and begin to access either money to be able to improve and deal with stresses. What has been your most fundamental observation on how we can snap out of it, but also prevent it, because you know what leads us into the depression?
You know, I think the very first thing is knowledge versus ignorance. Yeah. And so the entire ecosystem, from government to experts, right, and to media, we have to invest some time, quality time, to begin to create awareness. So how do we get airtime on all TV stations? Because this is a very critical, fundamental issue.
As
one
TV,
in four people.
Glad to amplify it through hosting you.
Thank you. And this is the second time.
That's right.
You know, that I've been on the station. So I celebrate NTV for it. But there needs to be more airtime. Newspapers, magazines, radio, TV, where, you know, experts are invited to come create a lot more awareness, talk more about it. Number one. Number two is government needs to begin to formulate the right policies. Number three, we need to have data. Number four, we need to equip the entire ecosystem with experts that can help solve the problem. Now, when you know, Chris, right, that the issues and the symptoms are XYZ, and you are beginning to catch it early with your brother, your sister, your colleague, your friend, then you, and there are therapists and psychologists and psychiatrists and coaches that are available to help. And there's information, right, that you can read up. And by virtue of that, you can begin to, you know, prevent. Then we'll begin to address the issues, because if you catch it early, you resolve it early.
Okay.
Also, stress, financial stress, relational stress.
There you have it.
You know, traffic. There's just so much that, you know, can be a trigger. And different people, right, have different resilience levels. We must build up our mental and our emotional resilience. But we must address it as it is. People will rather go and pray about it, fast about it. Fasting does not change your biochemical system. Addressing the issue is what I do.
All right. Time is not our best ally at this particular moment, but I'm glad that we can amplify this conversation way we are doing. You are a psychologist, but I'm sure you must be having some... Under what ages are you working?
Well, I work with executives, I work with leaders, I work with people from the ages of 21 above.
Above. Okay. Thank you very much, Dr. Lanre Olusola, a psychologist. And of course, we are emboldened by your perspective and ability to see the things and also tell us what we can be able to do. Talking about stress, time can stress on Morning at 10 TV. You need to be out because the producer says so. But there's a last ritual that we can undertake. Birthday wishes to Sharon Kayesu. And of course, Sharon Kayesu is the lady there. May the Lord add you more favor in all that you do, guide in your new age, full of abundance. Those wishes are coming from your family as well as your friends. Happy birthday, Sharon Kayesu. And that will do it for this edition of Morning at 10 TV. On behalf of my colleague Priscilla Regina Naloga, and indeed the team behind the scenes that ensures a smooth ride right from 6:30 to 9 o'clock. It's been a pleasure having your company. I'll see you tomorrow. Goodbye.